Jade, why did you decide to study nursing?
So I decided to study nursing because I wanted a career that really helped people. And when my nan was diagnosed with breast cancer, I saw the way the nurses treated her in the hospital, and I just really wanted to be close to the patients and make a difference in their lives. Who should study nursing?
Anyone can study nursing. People come to nursing from all different backgrounds, for all different reasons. We have people coming straight from school, we have people coming later in their lives, many of whom have had a situation similar to yours. They've had something happen in their lives where they've seen nursing as a career choice, possibly something they've never thought about before. But actually, anyone who has compassion, anyone who has a willingness to help other people can study nursing. Why did you choose the University of Sydney?
I chose the University of Sydney because of the opportunities that they offered in high school, like the scholarships, the social opportunities, and also the environment. The labs, I loved that it was really hands-on and that I could practice in the facility. What are the entry requirements?
So the entry requirements for the Bachelor of Nursing Advanced Studies are that you need to have an ATAR entry level of 84. But more than that, what we're looking for are people who are excited to learn. Within our program, we have it at an advanced studies level because what we would like to say from the University of Sydney's perspective, that we're interested in contributing to great nurses to the profession. And in contributing great nurses, we have a focus in our advanced studies program on being able to help people learn how to ask the right questions, to inquire, to actually take what they've heard, the knowledge that they've learned, and integrate that with the way they care for patients and people. And then more than that, to take it the next level and use that knowledge to influence healthcare, influence policy, influence the decisions that people make in their healthcare, and work with people to do that. So the entry requirements for the Bachelor of Nursing Advanced Studies are directed towards those kind of objectives, to actually attract people who are interested in contributing and thinking and really making a difference to nursing and to people's healthcare. What do you think are the best aspects of the course you're studying?
I love that with the University of Sydney, we not only do it like in the labs and practice like it's a hospital setting, but we also learn the theory side of it, so like biology, to really understand what we're doing in the labs. We get to go on placement and really experience the feel of the field and like know what it's going to be like when we actually graduate and get a job in that field.
Yeah, that's great. What is the day in the life of a student like?
Every day is different, so depending on whether or not we have a lecture or a tutorial, sometimes you might not even have to go to class to the lectures. You can watch them online. But yeah, it's very different to high school. You can sort of pick and choose your times and what time you're at uni and when you're at uni. Yeah, it's really great.
Good. Have you done your first placement yet?
Yeah,
Okay.
yeah.
Good.
What career opportunities are there?
So once you become a registered nurse, you usually find that most of the graduates have a idea in their mind about what they've fallen in love with, if you like, in nursing. Although I very often hear people say, well, you know, today I did my placement in mental health. Oh, I love mental health. I'm going to work there. And then the next time they do their placement in paediatrics, they go, oh, I love paediatrics. I'm going to work there. So you do find by the time you reach third year that you may have an idea about the area of nursing that applies, you know, that is most of interest to you. Being a generalist nurse is amazing. I mean, you make a difference to people every day, but mostly nurses will choose a specialty of some kind. And so, you know, any of the specialty areas in health is an area that nurses work. A growing area in nursing is, of course, working in the community. There's always been community nurses, people visiting in people's homes, doing telemedicine, all of that sort of stuff. But as the health systems around the world get more complex And inpatients tend to be more the highly acute people who are very sick. More and more of healthcare is conducted outside of hospitals, is conducted in clinics or in people's homes or over a phone or via an app or these sort of things. So you can really choose so many things.
How much time do you spend on placements?
Okay. So the placements and the length of the placements is determined by this ability to apply for registration as a nurse. And in Australia, it's determined that a student of nursing must spend a minimum of 800 hours in placement. So the placements are actually divided over the course of your program, so in the bachelor degree over the 3 years. At Sydney, we actually do additional placement time. We do 880 hours total in the Bachelor of Nursing. And there is also an option in your final year if you wish to do some more placement in an international setting. So whilst 800 hours over 3 years of the bachelor program is a minimum, often students end up doing more. So 880 for us, and then perhaps they might do a bit more.
Do you have to find your own placements?
No. We have a work integrated learning team, and they're a team of people who book all of the placements and make sure that everybody is fairly got access to placements. One of the important things for us is to make sure that your placements actually match to what you're learning at the time. So obviously we wouldn't want you to be a first year student and then doing a placement in some really high level acute setting like an intensive care unit. So the work integrated learning team, we call them the clinical placements team, are able to access a system that is operated by the public health system, and we book in to the placements each year. It's competitive. There's a lot of universities in Sydney that are looking for placements, but we have very good relationships with all our partners. We have about 150 different places where students go to. Some of them, many of them in fact are the acute care kind of hospital settings, but others are not. There are rural placements as well. And obviously if you're going on a rural placement, they'll be the longer ones, because if you're going to go to Broken Hill or Orange or somewhere, then it's better for you to stay a bit longer. What do you like most about living in Sydney?
Coming from a rural town, I know I have family that live rurally, and my auntie, she actually moved down here for university, and she just loved that all the job opportunities, all the social opportunities, and that there's so many people to meet, there's so many places to see.
Do you know anyone who lives on campus?
Yes, I do. I have a few friends that live on campus. They say it's really great because you can wake up 20 minutes before class. It's not as difficult. I live about an hour away, so I have to wake up a bit later. But yeah, it's really nice to have those social opportunities on campus. You're so close to everyone, you make really good friends.
Yeah, okay. Don't forget about next Wednesday. We've got the Semester 2 Welcome 1980s retro party as well.
Oh, really? I didn't even know about that.
Yeah, no.
Where's that?
At the school.
Oh, okay. Cool.